Welcome back, ladies. This segment is going to be about vaginal dryness and discomfort during sex when it comes to perimenopause. Vaginal dryness is a very common symptom of menopause. Many women find that they only feel dry during sex, while others experience it daily as prickliness, itching, irritation, and even pain in the vagina. Decreased estrogen can cause vaginal itching, dryness, or discomfort during sex. Low estrogen levels contribute to the vaginal dryness. Decreased estrogen can cause vaginal itching, dryness, or discomfort during sex. Low estrogen levels contribute to vaginal dryness, and symptoms include dryness and irritation of vagina, vulva, and urethra, increased pain during sex, itching or burning sensation in the vagina, painful urination, or difficulty peeing. Now, a lot of these symptoms that I just said also sound very familiar to some STDs, but keep in mind, this also has to do with low estrogen during your menopause and perimenopause period. Vaginal dryness can make you more prone to yeast infections, also called thrush, as the tissue is delicate and loses its natural defenses. Discharge can decrease or increase as the balance of bacteria that are naturally found in the vagina changes. You may also be more prone to bacterial vaginosis, or BV, where there is an imbalance of the normal bacteria that usually live happily in the vagina. If you have excessive vaginal discharge, this can sometimes cause further inflammation. Estrogen is needed to keep tissues well lubricated, healthy, and stretchy. Loss of estrogen in the perimenopause and menopause results in the tissues becoming delicate and dry. In addition, the usual elasticity of the vagina and vulva can be lost, which can lead to painful sex. Nobody wants painful sex. Well, maybe you want painful sex, but not that kind of painful sex. The vagina can become shorter and lose its usual folds. While vaginal symptoms of urogenital atrophy become more common with age, they can occur at any stage of perimenopause and menopause. So what can you do? There are a few things. Lubricants. You'll probably find it a good idea to start using lubrication during sex. You should always use lubrication during sex and foreplay and even masturbation. Use your lubricants. No matter how old you are, use your lubricants. It's important. Oil-based ones can be more effective, though they can make condoms less effective, so keep that in mind. You can also buy water-based and silicone-based lubricants. We all know KY jelly, there's other ones out there too. The key thing is finding one you like. You should avoid the lubricants with added extras, like a tingle or a heat. Any of those things, they can cause more irritation. Though those are fun, when you're going through this, it's not going to be so much fun. You should always use lubricant during sex. As I said, they're saying it too. I'm saying it. Always use lubrication when you're having sex. I used to sell sex toys, and that was one of the biggest things that we couldn't stress enough, to be using the lubricants. Water-based is one of the best, and water-based, you can use it in the shower too, ladies. You can use it in the shower and you won't get all, you know, when you kind of get dry because of the water, it makes it rough. Use your lubricants. All right, next thing you can use, moisturizers and washing. You can buy vaginal moisturizers over the counter, and they can help with day-to-day symptoms. The website that I'm getting all this from, it recommends that you avoid anything perfumed because, again, they can cause further vaginal irritation. Don't be spraying perfume down there. It's going to cause you more problems than anything else. If you have a smell, there's things you can do with that. And if it won't go away, go see your doctor. But don't spray perfume down there, especially on your bare skin. If you're putting it on the outside of your clothes, I guess that's one thing, but don't spray it directly on your girl. You'll most likely find it best to avoid all soap when it comes to washing, as it often dries out already delicate and sensitive skin. Instead, try using a soap-free wash or even over-the-counter emollient creams and ointments. If you ask the pharmacist, they will be able to point you in the right direction. Okay, this is what the website says, not me. I have to use soap. I use Dove because Dove is for sensitive skin. And it doesn't give me any irritations. There are a lot of strong soaps out there and a lot of soaps that have perfumes which could cause other problems. They do make feminine washes. We all know that. When they're saying soap-free wash, that's just using some water and washing it up. I have to wash. I'm one of those, I gotta wash it. I do. But that might not be suitable for you. And you know what, ladies? If you have other people in the house and they like a particular soap, you can have your own special soap. We used to do that in the house. My husband had, I think, Zest. Zest is harsh. And we had Dove. My daughter had very sensitive skin, and she needed, and this is just regular skin, her whole body, she needed something delicate, and her doctor recommended Dove. So we've been on Dove ever since. So next, it is always a good idea to speak to a doctor about your symptoms. A yeast infection can cause itching or icky, thick, white discharge, or no symptoms at all. You may think that you have thrush, but the symptoms may be due to a lack of estrogen. If your symptoms are persistent, a doctor may take a swab of the vaginal discharge. Pap smear, okay? At this age, you already know what a pap smear is, and you've had them. We don't like them, but sometimes you just have to do it. So I am somebody who already has a high content of yeast in my body, so I am prone to yeast infections really easily, or at least I used to be when I was younger. Going through perimenopause and menopause, I did have times where I was treating, there were times that I would treat for a yeast infection and it wouldn't go away. And so then I did yeast cleansing from my body. That's a whole nother topic, but you can find that. If you just Google search it, you can find ways to do that. So all of the stuff that I had just said is from mymenopauseCenter.com. The link and all the information is going to be down there. Now I did find other stuff, so I'm going to do that next. So some foods that can help: avocados, garlic, citrus, sweet potatoes, yogurt, kimchi, greens, broccoli, soy, hot chilies, vitamin E, fish oil, fish, cranberry juice, flaxseed. I didn't use any of these. That is not what I used. I used prunes. Back when I was going through this, I found that prunes was the best thing for me to use. Prunes are high in estrogen. High in estrogen. I ate 1 to 2 prunes a day for about a week, and then I dropped it off to where I was just eating a couple of them a week. All of these foods that I just said also contain estrogen, so they are helpful in the entirety. The prunes, I'm going to go back to the prunes. We all know what prunes will do for you. When you're constantly eating them, your body adjusts and you're not going to be running to the bathroom. However, we also know in our age and going through this, we are not regular, so the prunes will help you. However, you're not eating a lot of them, so it's not going to affect you in a horrible way where you're going to have to be around a bathroom all the time. Eating this many prunes, it cleared up the dryness extremely effectively. Cleared up the dryness. I got my sex drive back. I Didn't even have to have sex, and it was quite wet. Very, very. It was Niagara Falls. Okay, I am not somebody who's usually that excessive. This treated it. It was gone, and I didn't have to worry about it again. As far as the dryness goes during perimenopause, I've got other things that happen later on, but I'll talk about that when I get to those menopause and postmenopause. So, cranberries. Cranberries help with UTIs. They're full of antioxidants and acidic compounds, which are powerful infection fighters that help prevent bacteria from adhering to the bladder wall. We all know cranberries are wonderful. You can do dried cranberries, cranberry juice, but avoid sweetened cranberry juice with high sugar content. They also come in pill forms. The high sugar is not going to help you at all, so stay away from the added sugar. The pills come in the pill form too, so if you don't like the taste of the cranberry juice, if it's too sour, too tart, get the pills. But always do your research on them. Liquid and powder are always better than the hard tablet. And me personally, I always look for organic, no GMOs, I go through and make sure that there's nothing added to it. Sweet potatoes. Sweet potatoes help with bacterial vaginosis. They're rich in beta-carotene and vitamin A, which helps keep your mucous membranes healthy, including your vaginal tissues. High in fiber, which may help stabilize insulin levels too, which helps your blood sugar. Because remember, as we're getting older and we're going through menopause and our hormones are changing, so is our blood sugar and our cholesterol and our blood pressure, and everything is changing, so you need to keep a very good eye on everything that's happening to you. Probiotics. We all know about probiotics. Doctors always say, take your probiotics. It is so important to take your probiotics. Find the one that works best for you. Look around, read reviews, talk to your doctor. Do your research on what kind of probiotic is best for you. Let's see, omega-3 fatty acids can help with circulation, low libido, and period pain. So this one is really good. It helps with different things. It will also boost your libido. Omega-3 supplements may also ease painful menstruation, especially when combined with vitamin E supplements. Salmon, flaxseed, eggs, walnuts are just some. Fruits. Fruits that can help. Antioxidants can help improve overall blood flow and reduce oxidative stress. Key factors in libido and fertility. People who consume more citrus fruits may also be less likely to develop uterine fibroids. You don't want those. Pomegranates, blueberries, raspberries, strawberries, apples. Eat them whole or make a smoothie. And you're going to like one of those. And if you don't, there's other things out there. Avocados, one of my favorite things. You either like avocados or you don't. Avocados can help with low libido and vaginal dryness. Rich in healthy fats, vitamin B6, and potassium. Positively affect overall libido and natural lubrication. The potassium and the vitamin B6 also helps with some other stuff, which I'll talk about later on, and especially weight, but we're going to go about that one later. There are more ways to eat avocados than just guacamole, so look them up. I knew that avocados had the healthy fats. I've always known this. Not everybody does, but I've always known this. I was unaware that it was so good for you during perimenopause, and I wish I would have known because I make the best guacamole, but I love avocados. I like it on my toast. I like it in salads. I like it in everything. I would have eaten a lot more, and it helps with a lot of other things. Dark leafy greens are packed with antioxidants and enhance circulation. Improves the blood flow throughout the body, including the vagina. May help vaginal dryness and increase libido. also rich in vitamin E, magnesium, and calcium, which benefit muscle health, including vaginal muscles. So you're needing to make sure that those vaginal muscles are staying tight, along with the lubrication, not being dry. So here's the thing, is darky leaf greens help with circulation, including the vagina. So ladies, if your men are going through a change as well, give them some dark greeny leafy greens. It's going to help the circulation for them too, if you know what I mean. All right, those came from the healthline.com. That link is going to be down below as well. So something else I found was ginseng mimics the role of estrogen. It may help with dryness and boost your energy. Ginseng is a good thing. I mean, just if you don't know about ginseng, just do your research on it. That's all I can say. It is super, super wonderful. It's one of those it's not a drug. It's just does wonderful things. All right, so prunes. I'm going back to prunes. Prunes contain phytoestrogens, which are similar to estrogen and can help increase estrogen levels. Dried prunes have higher levels phytoestrogens than fresh prunes. Prunes also contain fiber and cinnamones, which help affect estrogen metabolism. Okay, that's the big thing, is your metabolism, because you're starting to lose your metabolism as well. That came from ScienceDirect.com. So the dried prunes are better for you than fresh prunes. I like the dried prunes. That's what I was eating a couple times a day, down to a couple times a week. Now I just take them when I'm feeling a little bit on the dry side. I'll eat one or two. So some studies suggest that prunes may help with bone health as well, which is important for post-menopause women who experience bone loss due to estrogen loss. Yes, you can lose your bone density, your bone loss, because of your estrogen loss. So if they're right, prunes will help with this as well. And that came from psu.edu. You know who Penn State is. So that link will be below as well. So dried fruits, in addition to being delicious, healthy, and rich in fiber, they are also a great source of phytoestrogens for those seeking to increase estrogen levels. Dried apricots contain the highest amount of phytoestrogen. So the high amounts in these dried fruits help to improve menopause symptoms such as hot flashes, mood swings, and lower the risk of cancer and cardiovascular disease. Those are important. That came from the intimaterose.com. And I believe she is a doctor, or all of her stuff came from doctors with interviews. So that'll be down below as well. For the vaginal dryness is coconut oil. Now, coconut oil, aloe vera, vitamin E, all these things, if you won't put it in your mouth and eat it, then don't put it on your vagina. Plain and simple. I buy organic, cold pressed coconut oil. I use it for my skin, my hair. You can gargle with it. It helps pull the mucus. What I do is I take a little bit, mine's in solid form, and rub it and just put it all on the outside, and it helps with the dryness on the outside, because when you become dry, you do become itchy. And the more you go through this whole process, the worse it's going to get, which I will cover once we get to postmenopause. But you can use vitamin E, you can use aloe, and you can use coconut oil. Now, coconut oil you can also use as a lubricant, but keep in mind it is going to break down the condoms as well. But it is one of the healthiest items that you can use. It's as long as it's organic and there's nothing extra in it. You don't want anything extra in it, just some simple coconut oil. And what else? Oh, it's a great sunscreen. I love it. I use it for everything. I cook with it. I eat, drink it. I use it on my skin, and when you first put it on, it's kind of greasy, but then within minutes, it's absorbed and it's not greasy. It doesn't leave a greasy residue. My hair right now, it needs it because it's not hair wash day. But you want to take care of the vaginal dryness because it is very uncomfortable, and it's going to only get worse as you go through the menopause. The more estrogen you lose, the more dryness it's going to happen. Coconut oil is moving from the kitchens and bathrooms to the bedrooms for many women who are discovering that among its seemingly magical cure-all properties, like I said, is the ability to help naturally lubricate and alleviate symptoms of vaginal dryness that often accompany perimenopause and menopause. Coconut oil is soothing, lubricating, and cooling, which is very beneficial for dry, irritated, and sensitive skin and mucous membranes. It also has antifungal and antibacterial properties, so it won't feed infections. That is so important. You don't want something that's going to cause an infection. Anything we apply topically to our skin should be pure enough to ingest, like I said before. So the stuff you would cook with is actually best. This website recommends organic extra virgin coconut oil. It's minimally processed, but the most important thing is to be sure there aren't any additives or fragrances. Do not use them with condoms, just like other products, like I said before. And that is hellobonafide.com. That will be down below as well. So I used prunes, coconut oil. I don't use Vaselines and things like that because it clogs and you can't breathe. Your skin cannot breathe with it. I mean, we all love, at least I do, I love some A&D ointment. It doesn't, it's not the best thing to use. Don't use that on a regular basis. As far as lubricants, you can buy them in the store. There's KY jelly. I was gonna say Special K. There's KY jelly. If you know anyone who sells adult toys, you can buy lubricants from them. Those are really good. They're water-based. You can always go to one of the specialty stores. If there's any in your area, they should carry it as well. But remember to stay away from flavored, heat sensation, tingly sensation, those things. That's not going to help you. It's going to help if you're wanting some freaky sex, but not for the vaginal dryness with perimenopause. If you have any questions, put it down below in a comment and I will look it up and get it to you. If there's something you use that's different than what I said, please, please, please post it in a comment. It's gonna help other women. So I gave you a list of different foods you can try. Try the foods. As long as you're not allergic to them, try the foods. If it helps, wonderful. If it doesn't, find something else. Try a different one. Don't try everything all at the same time though. Give it some time. If you're gonna do strawberries, eat a bunch of strawberries over a period of time and see if it helps. If it doesn't, then go on to the next thing. The pomegranates, the blueberries, the avocados, raspberries, strawberries, and apples. Try them independently over a period of time to see if any of them work. And what I personally would have done is tried them, figured out which ones work, which ones don't, And then all of them that work, I would put them together as a smoothie. And just because they're good. I like smoothies. I like fruit. They're good. But don't forget to subscribe, share, like, because it helps. And don't forget to comment. You have a wonderful day.